Good afternoon and welcome to the 2021 Shape America Virtual National Convention and Expo. My name is J Kissler and I'm with the Centers for Disease Control and Prevention Healthy Schools program. During today's session, you will be hearing from CDC and our partner organizations on how we are supporting physical education, physical activity, and inclusion. My colleague, Kelly Cornett, and I will be presenting on CDC's efforts along with Audra Walters with Shape America, Allison Tubbs with the National Center on Physical Activity and Disability, and Monica Klock with the Special Olympics. And before we get started, I just want to mention that the views expressed in written training materials, publications, or presentations by speakers and moderators do not necessarily reflect the official policies of the Department of Health and Human Services, nor does mention of trade names, commercial practices, or organizations imply endorsement by the US government. So during today's session, we'll be covering some commonly used terms and definitions related to disability inclusion, some relevant laws, current statistics, various strategies, tools, and resources that are available, and the important support our partners provide in this area. After today's session, we hope that participants will be able to describe at least 3 evidence-based tools and resources to support school physical education and physical activity, explain some creative ways how schools are using these evidence-based tools and resources, and identify CDC efforts to promote inclusion for students with disabilities. So what is a disability? When we talk about disability, it's any condition of the mind or the body or mind that makes it more difficult for the person to do certain activities and interact with the world around them. The World Health Organization goes a little further in defining impairment, activity limitation, as well as participation and restrictions in normal daily activities. So impairment is a person's body structure or function or mental functioning. Examples of impairments include loss of limb, loss of vision, or memory loss. Activity limitation can be things such as difficulty seeing, hearing, walking, or problem solving. Participation restrictions in normal daily activities such as working, engaging in social and recreational activities, and obtaining healthcare and preventive services. Disability affects approximately 61 million people in the United States, about 1 in 4 adults, 26% of adults. We know that people with disabilities are at a significant disadvantage when it comes to health when compared with the general population, and are more likely to be obese, smoke, have high blood pressure, be physically inactive, and oftentimes don't receive some types of the recommended preventive screenings. These are all preventable factors that can increase the risk of chronic diseases such as heart disease, stroke, diabetes, and some cancers. Approximately 14% of students have a disability, and schools are in a unique position really to promote healthy behaviors early in life prior to adulthood. Most US children spend an average of 6 to 7 hours a day at school, which is a large part of their waking hours. So what do we mean when we talk about disability inclusion? Inclusion means that students with disabilities participate in all activities equally with other students and have the right to be respected and appreciated as valuable members of the school community, and interact with peers of all ability levels, and have opportunities to develop friendships. Within the context of physical education and physical activity, disability inclusion means that all students, regardless of ability, should get the nationally recommended 60 minutes or more of daily physical activity. Specifically, inclusive physical education and physical activity includes students with disabilities in regular physical education classes, and teaching strategies may be modified, and equipment and environments and assessments can be modified or adapted to meet the needs of all students. It supports the students with disabilities who want to participate in other physical activities before, during, and after school. It also encourages students with disabilities to have the same roles and experiences of their peers who do not have a disability during physical education or during other physical activities. 3 federal laws protect the rights of people with disabilities and ensure their inclusion in many aspects of society. The Americans with Disabilities Act protects the civil rights of people with disabilities and has helped remove or reduce many barriers for people with disabilities. Schools are required to comply with the accessibility requirements of the ADA and provide appropriate physical education and physical activity opportunities for students with disabilities. Section 504 of the Rehabilitation Act of 1973 prohibits discrimination based on disability in any program or activity operated by recipients of federal funds. Title II of Americans with Disability Act of 1990 prohibits discrimination based on disability by public entities, regardless of whether they receive federal financial assistance. Finally, an individual with the Disabilities Act mandates the provision of a free and appropriate public school education for eligible students ages 13 through 21. And now I will turn it over to my colleague, Kelly Cornett, who will be talking about the current status of inclusion in physical education and physical activity.
Can you see my notes? Okay, all right. So then he just said pass to Kelly, right? Okay, all right. Thanks, Chris. Before we dive into helpful resources from our partners on today's call, it's important to understand the current context. I have to start with some not so good news, though. Only 24% of youth with disabilities are meeting the 60 minutes or more of physical activity daily recommendation. Furthermore, when we look at the issue with more of a school-wide lens related to physical education policies, 52% of schools exempted students with cognitive disability, and 86% of schools exempted students with long-term physical and medical disability from physical education. But it's not a lost cause. I do have some good news at the school district level. Most school districts require schools meet the physical education needs of students with disabilities through accommodations in 504 plans or individual education plans, and providing adapted physical education along with regular physical education class. There's still a lot to improve upon, given that 55% of schools that require physical education for students with disabilities do not provide adapted PE, but we are moving in the right direction at the district level. To reiterate why this is important that we increase opportunities for adapted physical education, we see that 91% of schools that have students with disabilities include PE in individual education plans for these students. These are customized plans for a student with disabilities that a team within the school comes together to create and review on an ongoing basis and update as needed. To get these types of plans off the ground and implemented, however, resources and professional development is needed. And we've seen an increase in the percentage of school districts that provided funding for professional development on teaching adapted physical education. So that's great. There are a few resources available that can help give a better idea of the current context related to adapted physical education offerings at the school policy level. Schools are required to have adequate policies and practices that align with federal policies for inclusion. Schools also need to be aware of any additional policy guidance from their state or school district. At the state level, relevant policy information can be found in the 2016 Shape of the Nation report, which includes state profiles. Also, NASB's state policy database, which allows users to search for specific language in a law, pull up actual laws, and you can even select physical education and physical activity as subcategories for adapted PE requirements. At the district level, expectations for inclusion might be found in the local wellness policy examples of model wellness policies for inclusion. So what can be done to further promote inclusion? Here we list 6 actions on 2 slides that state leaders can take to promote inclusion in physical education and physical activity at the district and school levels. First, share any state laws, policies, and guidance with district and school staff. This includes policy language around inclusive physical education, adapted physical education, professional development for administrators and staff about building a culture of inclusion, and certification of staff working with students with disabilities. Second, share state level data about students with disabilities with educational and health leaders. There's several interactive data sites where you can use and identify estimates about students with disabilities. Starting in 2020, CDC's School Health Profile Survey will have 2 questions related to inclusion. Third, identify and reach out to state and district partners that are already leading inclusion efforts and look for opportunities to collaborate. Potential partners include state disability program staff, Special Olympics state affiliates, local university departments working on adapted physical education and inclusion. All of these things are really great. And there are also a speech therapist that can be part of that team. CDC funds 19 under the state disability and health programs. All right, more opportunities that can be done. Next, we can conduct a brief assessment of current activity and needs. This assessment should identify any current activities for inclusion at the state and district levels, like programmatic efforts, built environment improvements, funding, professional development, and any needs at the district and school levels for inclusion. The National Center on Health, Physical Activity, and Disabilities Community Health Inclusion is an example of one of those assessment tools. It is designed to collect information about healthy living resources and the degree to which they are inclusive. Fifth, provide training to district and school staff on how to create an inclusion comprehensive school physical activity program to ensure that physical activity opportunities are accessible and inclusive before, during, and after school. And then finally, engage partners and university programs to train current and future school leaders, physical education teachers, and classroom teachers on best policies and practices for inclusion. This can include learning about how to make adaptations and accommodations to facilities, rules, equipment, instructions, and assessment. So lots of opportunities there. Here, I wanted to show some of the websites and resources that are currently available. These are at the federal level, and they can all be found on the CDC website here. And then, of course, this is a team effort here, always acknowledgements from other CDC colleagues who have truly contributed to this work, Shannon Michael, Sarah Lee, and then Melissa in our program branch. Thank you so much. And now I'm going to pass it over to our partners who are supporting resources and what they provide. Audra?
I think I am good. Great. Hi, everyone. I'm excited to be here with this great group of folks talking about inclusion. I'm Audra Walters, and I'm the project director for the CDC Cooperative Agreement that supports school health with a focus on physical activity and physical education at Shape America. I wanted to take just a few minutes to talk about some of the newest resources that we have that support adapted physical education. So right before winter break, we released a free interactive course on the Shape America Online Institute called the Roadmap to Adapted Physical Education. It's a self-paced course that walks through the core components of providing adapted physical education services and describes the legal requirements and guidelines, as CDC already mentioned earlier, as well as some key terminology and resources. I want to emphasize, as Kelly mentioned, that ideally students in need of adapted physical education services would have access to a licensed or certified adapted physical education teacher. But we all know that's not always the case. So this course is for folks that are not familiar or not as familiar with providing those adapted physical education services, or who may not offer standalone adapted physical education classes at their school. So I wanted to show you how it's laid out in case you haven't done one of the free courses on the Shape America Online Institute before. As I said, it's self-paced and it takes on average 2.5 to 3 hours to complete. We've actually built in some physical activity breaks into the course, so you can pause if you can't complete it in one setting. And the idea behind this course is to guide PE teachers in reflecting through not just the federal requirements, but also their state, district, and program requirements and needs. And there are critical thinking tasks throughout this course, as well as engagement activities to keep the course engaging and relevant and interactive. So this is a visual that I really love that builds throughout the course, which shows how the core components make up a process or a roadmap to provide adapted physical education services. And I think this visual is particularly helpful for those that don't regularly participate in this process. It makes it very user-friendly and practical because it breaks down step by step the process of providing these services, from the initial referral to all the way to inclusive instructional strategies in the classroom. If it's not a process that you're familiar with or have to do frequently, it can seem very overwhelming with all of the layers of requirements from the federal, state, and local levels. So I think it's a really nice way to make it a very user-friendly process. And so all of the engagement activities that I talked about that happen throughout the course build up to a final project that can serve as a personalized reference tool, or basically a quick reference guide of not just what the federal laws and guidelines are, but what your state and district requirements are. So it's all in one place in this 2-pager that's a quick reference by the end of the course. Another resource that's available is the Toy Talk Tuesdays on YouTube with National and District Adapted PE Teachers of the Year, or affectionately called TOYS. As you can see, there are 3 episodes where TOYS share their tips and lessons learned, including resources they've used in creating engaging adapted PE lessons for virtual, for face-to-face instruction, for hybrid learning environments, all of the flavors of education that we've had this past year. And these episodes are short, they're less than 15 minutes, so it's a great way to get some condensed learning from folks that are doing this day in and day out and are doing it really well, because they're the best of adapted physical education teachers across the country. Episode 16, I think, is particularly interesting as it was recorded in February. So these adapted PE toys are really able to talk really practically about what's worked for them this school year. Some of the tips are higher level tips, like emphasizing the importance of consistency and a routine schedule for students with autism. And some higher levels tips also include the importance of communicating with service providers and other teachers, parents, and then the students themselves. And then some of the other tips are really specific strategies or technologies that have been used, or resources that these teachers use to make their lessons really engaging, whether that's virtual or hybrid. And the teachers that do these Toy Talk Tuesdays are really inspiring and incredible, so I encourage you to check them out. So with that, those are the newest resources that we've had available that have come out in the past couple of months. If you have any questions, I'll be answering in the chat box. You can always email me or connect with Shape America on social media if you want to engage or have any questions. And I'm excited to turn it over to Allison next, who has some amazing resources she's going to be sharing with y'all.
Oh, darn. Hang on. I did from the beginning. Okay. What can you see? Oh, okay. Okay, hang on. So how do I pull up my notes side by side? So I can't exit full screen mode while sharing. Okay, that's okay. Oh, is there captioning provided in these sessions? Right. Well, that is something that we should probably make sure there is. Okay, well then I don't know how to turn that off. Let's see.
I could share them if you want, Allison, and you can request remote control if that would be better.
Yeah, that might be good. Thank you. Let me just pause share. Okay, or stop share. Okay, let's try that. Yeah, we have that live caption set up. I think it's on all of our computers.
Which is awesome.
Yeah.
Here you are. Yeah. Now I'm going to do slideshow. Okay, so go ahead and request.
Okay. Is it advancing?
Yep. Now I need to figure out how I can mute myself.
Everything good?
Yeah, please. Thank you. Oh, yeah.
Oops, that went back. I'm just trying to get back to the front screen. Okay, nope, I think I'm good. Okay, hello everybody. My name's Allison Tubbs and I'm with the National Center on Health, Physical Activity and Disability, or NCPAD is what our acronym is spelled out. We're a national resource center and practice center. We focus on health promotion, wellness, and disability, and we're funded through CDC Center for Birth Defects and Developmental Disabilities. And our center focuses across disability. We also cover across the lifespan, so all the way from children to older adults. So I'm happy to be here today, and I'm going to share briefly about some of our education and school focused programs and resources around inclusion and school wellness. So the work that we do is segmented into 5 focus areas, and we do have a specific focus area for educators. So you can find this information at our website. It's nchpad.org/educators. And here on this page, you'll get access to free content, and it includes customized videos. We post trending topics. We have guidebooks, fact sheets, and toolkits that can be downloaded for free. We have an e-learning platform for on-demand trainings. We have a customized newsletter that will be delivered to your inbox quarterly. And you also get access to one of our expert information specialists who is available Monday through Friday, 9 to 5 p.m. through a live chat on our website. You can call a toll-free number or send an email, and we will answer any question that you have related to inclusive physical education or physical activity. Also wanted to point out on this site, we have some specific resources that we've created this past year during the pandemic related to COVID-19 and response. So I mentioned our e-learning, wanted to dive a little bit deeper here. and share that this is a free e-learning site, on-demand ready content. It's ready for you when you are, and you can access it. Some of the content that we have specific to education and professional development looks at universal design for learning. We have a whole course on individualized education plans, or IEPs, that we've heard about already today. We have a general disability education training on inclusive brain boosters, and general inclusive physical education. All of our trainings, like I've mentioned, are free. They also come with a certificate of completion if needed to turn in for your continuing education hours. And then we are certified through the American College of Sports Medicine, or ACSM, as an approved CEU provider. So we can get you CEUs through them as well. So earlier we heard from our colleagues at CDC about some of the data around disability prevalence and the need for inclusion in schools. So I wanted to just share one more data source that we have related to that. And it was a survey report that we worked on in partnership with Active Schools. In this survey, we addressed meeting the needs of students with disabilities for inclusive physical education and physical activity. The survey was initiated for physical education teachers that identified as a champion through their school for the Active Schools network. And in it, we report on participation levels, classroom strategies, after school programs, certain certifications and support that teachers need, preparation, and then the built environment. So we had a total of 742 PE teachers across the country respond. So it's a pretty diverse survey and report of needs. So next I want to dive into some of the specific resources that we've developed to support inclusion in school wellness. And those include a Discover Inclusive School Wellness Toolkit that has 3 components: a guide, an action plan, and a toolbox. And what these tools are designed to do are help assist schools and school districts in developing and implementing your school wellness plans and programs to be inclusive of students with disabilities. So the first one is the guide, and this is a direct adaptation of the CSPAP program, or the Comprehensive School Physical Activity, that was developed by CDC. So in it, you'll see strategies and resources that we have matched directly to the 5 areas of CSPAP. So looking at physical education, physical activity before and after school, physical activity during school, family and community involvement, and then staff involvement. The next tool is the action plan, and this one dives a bit deeper into the same 5 components, and then we also add 2 more here. So we have added policy and implementation, and then nutrition education. So what this resource is, it's designed to be printed out, filled in with those working on your school wellness plan, and it spells out specifically what action steps to take, where and how you consider disability inclusion within those action steps, and then it matches you with a suggested tool or resource to assist you with the implementation of that action step. So we really tried to spell it out and make it simple for people to really make sure that they're inclusive in their school wellness programs. And then the last tool is our toolbox. And then this is the resource that directly accompanies the action plan. And if you view it in a digital format, it has hyperlinks ready to go and matched with each of the 7 areas of concentration. So I also wanted to mention that we have a few standalone flyers or resources that also support this toolkit. And these are really designed to be shared with your administration or your school boards to help you address the why of doing this work. So what these include are adapted model wellness policies for schools or districts. So we've literally written it out for you. And if your school or district does not have a wellness policy in place, you can copy and paste and plug in where it fits for you. We also have some quick tips on if you do have a wellness policy and plan in place, how you can review that and make sure that you have disability inclusion built in throughout. And then the last one is just general about the why and the need for inclusion in school wellness policies for your administration. So when we get to the practical application of these tools and resources. We heard the strategies from Kelly earlier in the CDC guidebook. And so I just wanted to build on a little bit further on that. You know, we know what works for one school doesn't work for another school or community. And also no one child with a disability is the same. So how you really make inclusion happen is best done specifically for those that you're serving. So you have to be adaptable and you have to be customized to your local context. But some general tips here are make sure that you're always including people with disabilities on your committee. So there's a person-centered approach. There's a mantra in the disability community of nothing about us without us. So we want to make sure that people with disabilities are directly involved in the initiatives that we're doing. And this can, you know, look a couple different ways. You could have a parent of a child with disability involved. You could have an actual youth student with disability in your school involved that's older and that may be able to contribute to meetings. Also connect with your local disability organizations. Maybe your state Special Olympics chapter has a representative or an independent living center in your area and invite them to your school wellness committee and meetings. Another thing to note is that make sure that all of your staff have disability education training. You want to do this to make sure that everyone has the same base level of knowledge around inclusion within your school community, what accessibility is, what language to use, and just generally how to interact with students with disabilities in your school. We do have a free training on that on our e-learning platform on disability education that you can check out. Couple other components, make sure that your assessments that you're doing, whether you do them annually or quarterly, look at all the different structural components within your school community, playgrounds, sidewalks, water fountains, bathrooms. What can you do to make sure that these components are inclusive of students with disabilities? And how do you need to add that to your budget or need to prioritize grants for these components? So at NCPAD, we have an evidence-based framework that we've used that allows us to adapt existing programs to add disability inclusion components in. So I wanted to just quickly share some of the programs that we have worked with. And we do recommend use of these programs in your inclusive physical activity work, because we know that inclusion is built in throughout, because these are folks that we have worked with over the years. So some of them are the Women's Sports Foundation. They have a physical activity program called Go Girl Go. Catch Kids Club after school program now has a full inclusion guide and training videos that support. The SPARK program has an inclusive physical education addendum that's part of their curriculum. HEAL is healthy eating physical activity program. It started in Alabama, but it's a physical education curriculum that's now available in more states. And then the Let Me Run and the Girls on the Run are running after school programs for boys and girls. So lastly, just wanted to quickly mention a few additional resources off our website. I mentioned the COVID-19 specific work that we've done. We have a comprehensive list of resources for inclusive physical activity to do while you're doing remote or learning at home. We have an interactive roadmap to the IEPs to make sure that physical education and health goals are included and written in the IEP, which is very important. We have several educational videos that we've published recently on the topic of universal design for learning, and we've developed these in partnership with Human Kinetics and Dr. Lauren Lieberman. And then lastly, we have a guide on hosting inclusive virtual wellness activities. And so this talks about, you know, how you address your visual environment in your virtual space, your instruction methods, accessibility within the platform that you're using, and then your learning process. So that's it for me. Thanks so much for having me. Please stay connected with us on our website, and then we're also on these social media channels. Thank you. And now I'm going to pass it to Monica with Special Olympics.
Do we want to stop share or just do technical? Quick question. Do we know at what we're at right now because I have us at 35 minutes and I need to figure out how fast I need to roll through this. Yeah. Okay. And Chris, do you still want me to pass it back to you at the end to close us out?
Nick, what do you think is the best way to do that? I mean, as far as like when it gets viewed by at the virtual conference piece, and then there's a question and answer side. So do you think it's okay if like Monica passes it back to me? Do you want me to say something like, oh, okay, now, please, if you have questions, enter them into the chat box?
And I feel really bad, Monica. I think that we may have had the timing wrong, Chris. Were we supposed to split the 10 minutes between us?
You're good. You're good. We got this.
I think we thought that we each had, that's why I went into depth on this. I can totally redo my part to make it shorter.
No. We're fine. I got this. We're good.
I feel bad now. Okay.
No, don't. We're
So
good.
I can totally shorten. I wasn't going to read everything on those last two slides. But
No worries. We're good. Chris, passing it back to you. Or you may just kick us to the queue.
Why don't you just say, at this, time, feel free to, why don't you just end it like that? Like,
Cool.
feel free. Does that sound good?
Yep. Sounds good.
Okay. Thank you.
Yep. We're good. Thanks, Allison. Hey, everyone. My name is Monica Klock. I'm the manager of fitness for youth in schools at Special Olympics. And just want to quickly share some of the resources and programs that we have available specifically for schools and youth when it comes to physical activity, physical education. And the great thing about all the programs and resources that I'm going to share today, they're all done in an inclusive environment. We're always bringing together students with and without disabilities within our school settings. And so we'll kind of just get started with our Special Olympics Young Athletes, which is an inclusive sport and play program for children with and without intellectual disabilities ages 2 to 7 years old. And so this is a really great program that brings together children in a school environment to learn, to play, to grow together. Not only are they working on things like running, kicking, and throwing, but they're starting to, things like taking turns and sharing and following directions. And so it really provides this age group a really early kind of onset of inclusion and seeing what that's like at a very early age. Our young athletes team has a lot of great resources. We have the activity guide, we have cards, videos, we have a young athletes kit, a lot of really great resources that you can utilize specifically for this age group. And then we have our unified physical education, which is a concept for bringing students with and without disabilities together as equals in a physical education setting where all students earn physical education credit. And it's really important to note that this is not meant to take or replace adapted physical education, but it's an additional opportunity to bring students with and without disabilities in their least restrictive environment into that PE setting together. And so we have our unified physical education resource that really provides a really good overview of unified PE, what it is, how to get started. There's even things in there about maybe those first couple of classes when you're bringing together students with and without disabilities, how to start to break the ice a little bit, how to have them come together and start to build those relationships that you typically see within the PE setting. And so there's a lot of great things that already exist. This is actually one of our most implemented programs within our Unified Champion Schools movement. And so a lot of great things within that resource. And then next we have our unified fitness. Physical fitness is a really key component of our Special Olympics mission. And so over the last handful of years, we've really been focused and ramping up the resources that we have available to get more people moving and active. And so we define fitness as the optimal health and performance through physical activity, nutrition, and hydration. And we really focus on those three components and making sure that we're impacting the overall health of an individual. And so we really saw the last 3 years that schools is an excellent opportunity for us to continue to allow youth to be physically active through Special Olympics fitness. And so during the last 3 school years, we created the Special Olympics Fitness Guide for Schools, which again, much like the Unified PE resource, it gives you a lot of great things about all the things that we have available to you with Special Olympics fitness and how to get started, things to think about setting and making it a more inclusive environment. And the best thing about our Special Olympics fitness work is that it's very flexible.
Hi, everyone. Are we live now? So thank you to everyone that is joining us live. We obviously have had some technical issues, both live today and I think we discussed amongst ourselves as panelists. We're going to go ahead and tell on ourselves. That was a pre-recorded session, and we thought those transitions will be edited out. So it just goes to show you that you cannot escape technical issues, regardless of if you are in person, if you are pre-recording, or you are going live. So thank you all so much for your patience with all of us. If you have any questions, feel free to put those in the chat. Otherwise, I'm going to see if any of my fellow panelists have any final comments they'd like to say, or any websites they'd look to point out that we haven't already covered in our presentation. So thank you so much for your patience and for bearing with us.
I just wanted to say that I appreciated the comments in the chat that were just so supportive, and that meant a lot. So thank you.
On behalf of CDC, I want to thank everyone that participated in the session today and hearing from all the wonderful work that our partners are doing. So we appreciate you attending and do apologize for the technical issues. Thanks.
And good news. Oh, sorry. Go ahead, Allison.
I was just going to say hello to everybody. This is Allison with NCPAD. Thanks for joining us. And I did see some questions about links to programs and resources. So I just wanted to share that the content that I presented on our Discover Inclusive Wellness Toolkit is available in the handouts on this session. But everything's also on the website at nchpad.org. Thanks.
Hey everyone, Monica Klock here with Special Olympics. Thanks for joining us today. A little bit of the session got cut off there at the end. So if you want to learn more about the things that we're doing at Special Olympics, feel free to look in the chat. I shared a couple of links and my email address, so feel free to reach out. Thank you.
Awesome. And so I just want to say again, thank you so much for joining us. And good news is that this is something we'll be able to fix for all the people watching in the future. So we're going to be able to re-edit this recording. So please feel free to share far and wide starting next week. And thank you so much to those of you that were joining us live. It looks like from just about every time zone possible, which is one of the really cool things about Shape Virtual. So thank you again, and feel free to connect with us on social media. Thanks so much, and enjoy the rest of convention.